Hello, welcome. My name is Sharon Gainforth, and I will be the narrator for this virtual tour through Stepping Stones. I'll start off by telling you a little bit about me. I'm a speech pathologist by trade. I graduated and started working in 1980. I recognize that that's a long time ago, but I still love it. And the very first little guy that I had as a client had autism. And he was 2 years old. He was blonde, blue eyes, absolutely adorable. And he had very little social interaction, no verbal words. And I just had the privilege of being present when he said his first word, the first time he called out to his mom using her name. He realized that it was more fun to be with his mother than to not. Presently, I'm working on my PhD in infant and child development at the Fielding Graduate School, which is in Santa Barbara, California. It really has been a great experience, as even though it is a PhD in infant and child development, every course really specializes in autism. So everything that I take is so applicable, I can use it here at Stepping Stones. So as the director, I extend to you a very warm welcome to you and your child. Have you ever gone into a building and the very first thing you see on the wall is a vision statement? Well, I have a vision for your child. It may not be written on the wall here at Stepping Stones, but I can assure you it is engraved in my heart. I have many responsibilities here at Stepping Stones, but the one that I hold most dear is to spark this passion in every one of our employees as we work together to help your child achieve his or her maximum potential. The Autism Initiative funding has provided all agencies with a set of standards. These standards are the framework for our agency. The whole point of this video is to offer you a better understanding of who we are, what we do, and what you can expect. We hope by the end of this video, you will not only see that you are in excellent hands, but you will also feel very supported. I'm now going to take you through our process, step by step, from when you first walk through our doors until your child transitions into school. Let's start with a developmental assessment. Here is Dr. Joe Trainer.
Hi there, I'm Dr. Trainer and I'm a psychologist at Stepping Stones. All of the children who come to Stepping Stones have already been diagnosed with an autism spectrum disorder. But we often have families coming to us, sometimes feeling a little bit uncertain as to how or why their child was diagnosed. This is a valid concern, and sometimes the diagnostic process itself can be confusing. Autism is a developmental disorder that's characterized by impairments in social interaction and communication, as well as restrictive or repetitive patterns of behavior and interests. Although autism is generally accepted as being related to neurological brain development, and in a minority of individuals, it's even associated with a known genetic syndrome, we still don't really know what the exact causes of autism are, per se. We do know, though, that autism affects about 1% of the population, or close to 1%. And in one recent study in the United States, in their area, they estimated that about 1 in 68 children had been diagnosed by the time they reached 8 years of age. We also know that autism is diagnosed about 4 times more frequently in males. Receiving a diagnosis of autism spectrum disorder can happen in a number of different ways. It can sometimes be diagnosed by a psychologist, and other times by a physician, such as a pediatrician or a neurologist or a psychiatrist. In any case, the professional who is assessing a child for autism is looking for a number of different things. This includes the child's general social behavior, as well as their interests and the qualities of relationships that they have with other children, including how they play with other children, for example. We also want to know how they handle changes and deal with sensory input as well. And we want to know about their speech, language, and communication skills. Obviously, having a child be diagnosed with an autism spectrum disorder can be very difficult for families and can be a very scary thing. There is a lot of research that suggests that autism intervention during the early stages of a child's development can be highly effective. It's thought to maximize social skills and social engagement with other people, as well as improving speech, language, and communication, and it's been associated with better intelligence and thinking abilities. Our job here at Stepping Stones is to support the children as well as you, the families. In addition to the team of professionals that you'll be working with here at Stepping Stones, we also offer support groups for families as well as training seminars for families to help them be the best supports that they can be for their children at home. Thanks for listening.
So you've gone to the doctor and your child has been diagnosed with autism spectrum disorder. You called Stepping Stones to initiate the process of intervention for your child, and you received an appointment for a needs assessment. You think, what is that? Basically, a needs assessment is an opportunity for us to get to know about your child, and you have a chance to ask us questions that you want to know about our therapy and Stepping Stones. In addition, we sign consent forms and do all of those logistical things. But quite frankly, the needs assessment is all about you and your child and informing us, giving us that information for us to do the intervention that we need to do for your child. Now that we've completed a needs assessment and have all the necessary forms signed, the next phase is our assessment process. It's important to know that our assessments are solely for the purpose of establishing goals, engaging improvements in your child's abilities. Stepping Stones does not diagnose, we don't offer second opinions, nor do we designate severity levels. We are exclusively here for your child's intervention and development, and also, very importantly, to support you. The assessments will look at your child's ability to communicate and socially interact. Does he actively engage with you? Does he use gestures, sounds, words, or sentences to communicate? And how well does he understand what is being said to him? We will look at your child's play skills. Does he play with a large range of toys? Does he play interactively with you? Does he play with peers? Does your child play in a very reciprocal manner? We will also look at your child's self-help skills. Is he toilet trained? Can he get dressed on his own? If not, is it due to his ability, or perhaps it's due to his interest level? Also, we will look at your child's fine and gross motor skills. Assessments are critical in developing a plan for your child. Think of them as a roadmap. No, in today's world, as a GPS system that gives us a baseline and direction in determining your child's strengths and weaknesses in the domains of social skills, communication, fine and gross motor skills, language, and cognitive function. Ultimately, we want to see your children succeed, and these assessments help us create a unique and individual therapy plan that targets their specific goals and objectives. Following your child's assessments, you will be invited to attend the initial team meeting. It is at this time that the testing results will be discussed. Your input is very important as well. Who knows your child better than you? At this meeting, initial goals will be selected that specifically reflect the assessment results and your input. We want the goals to be fine-tuned to your child. If there are professionals that have been involved with your child from the hospital, say, or daycare, we want to hear from them as well. So please feel free to invite them. The more we get to know about your child, the better we are able to implement goals that are attainable and appropriate. It is almost time for your child to start intervention. You may be wondering who will be working with your child. On your child's team, there's a clinical supervisor or client supervisor, and their responsibility is to oversee your child's intervention plan from the beginning to the very end. This involves the development of an individual program plan for your child. It involves ongoing assessments, data review, new goal implementation. The CS really is your primary contact person. Next, we have an autism support worker, or what we often refer to as an ASW. They are the ones who will be in direct contact with your child every day. Once they receive the programs from the clinical supervisor, they will be shown how to facilitate the appropriate techniques to ensure your child's success. Next, we have case managers, or what we refer to as CMs. Case managers are very skilled in the therapy process, in therapy strategies and techniques. Their position is to offer another support system to the autism support worker. They help ASWs with everything from learning administrative processes, recording data, behavioral challenges, and transitions. The case managers, clinical supervisors, and autism support workers are a very tight-knit team that offers support for your child. At Stepping Stones, we want the absolute best for your child. That's why we work with a multidisciplinary team. And the team consists of behavior analysts, psychologists, occupational therapists, music therapists, and a speech-language pathologist. Consults to these various professionals will be made as the needs arise. So hopefully you've been following the process leading up to the point your child begins intervention. You now may be asking, what kind of intervention will my child receive? What will the goals be? We are funded to provide intervention that is evidence-based. That means that repeated research studies support the effectiveness of this model of intervention. And the primary model that is evidence-based is called ABA. ABA stands for Applied Behavior Analysis. Quite simply, ABA looks at increasing behaviors or decreasing behaviors. For example, perhaps you want your child to begin saying words to communicate. That goal essentially will become the behavior that we want to increase. We will use strategies that have been proven effective. We will take data to determine whether we are being effective or, quite frankly, whether changes need to be made. As to the question, what kind of goals do we work on? Let me break down the process for you and hopefully answer this question. Autism spectrum disorder is a developmental disorder characterized by social interaction. This means that children usually have difficulty in areas of communication, requesting, pretend play, flexibility, commenting, initiating play, and expressing emotions appropriately. You will notice that I did not say that autism is characterized by difficulties with academics. In fact, sometimes we see that children with autism excel with academics. This amazes us, and it is something to celebrate. The problem with this is that even if your child can answer 2 + 2, if the child cannot socially understand or is unwilling to answer the question in a school environment, he may not receive the grade that he deserves. That is why we focus on communication and social interaction as our primary goals for your child. Scientifically, we understand that there is a developmental process called attunement and engagement that develops at a very young age. During this process, a child's brain is creating thousands of neural pathways a minute and are constructing their social brain. During this time, the baby learns reciprocity, that the outside world is responsive. We see this when babies smile or laugh at their mothers and their mothers smile and laugh back. What we find with children diagnosed with autism is that they are not as engaged in this process, and in turn are not forming the connections needed for social interaction. This means that our first steps are goals such as engagement and joint and shared attention. Once we have reached goals such as these, other goals, such as language and communication, follow so much easier. Once we see that your child is communicating and engaging with the autism support worker, he will attend a social skills group so that he can generalize his skills to peers. We offer a variety of different social skills groups, which reflect a variety of goals. Your child's needs and abilities will determine the group that he attends. The groups are built around teaching social skills through play and having fun. If you have a child with autism, you will know that any type of change may be difficult From time to time, the children will experience change, such as changes in their autism support worker. We do this sometimes intentionally, and sometimes due to logistical issues. What we do know is that regardless of the reason behind these changes, change is a concept easier taught when your child is young. We want your child equipped with the most tools we can give them for the real world. Coping with unexpected change is crucial in multiple environments, including home and school. So yes, there will be change, and I know this can be difficult, but it is for the benefit of your child. We take your child's transition to school very seriously. We want your child to continue making progress. In light of this, the transition process starts well before September of the year that your child goes to school. Approximately 9 months prior to the beginning of school, you will be asked to complete forms that allow us to meet with your child's future school team. Anywhere between 3 to 6 months prior to school beginning, a comprehensive team meeting will be initiated by the school district that your child will be attending. The purpose is for the school to learn about your child's strengths and their needs, so they can be prepared to help your child with a smooth transition. You will play a huge role at this meeting as you describe your child and state what you perceive your child's needs to be. Approximately 3 to 4 months prior to school beginning, a methods and resource teacher specialized in autism typically will attend Stepping Stones to observe your child here. It is very important that your child is seen in a learning environment that is comfortable for him to showcase his abilities. And then quite a lengthy report will be provided to the school that outlines your child's accomplishments, his present goals, and very specifically the teaching strategies that have been found to be successful. In September, your child's transition to school will be supported by a member of his Stepping Stones team. Strategies are demonstrated to the teachers as needed. The intensity of your Stepping Stones team will reflect your child's need at that time. So, thank you for watching this video. I hope that it has helped you understand Stepping Stones. I primarily want you to remember that it is our passion to help your child achieve his maximum potential. Your child is a unique individual and will be valued as such. Intervention will be specific to your child. We will primarily target the skill sets that define autism. You are a valued team member. We welcome your input. We have an open door policy. Come and observe intervention at any time you wish.